Hello, my name is Chloe Smith. I am in microbiology applications, and today I will be just discussing about my disease of yellow fever. Now, before we start, I thought it was pretty interesting that I chose yellow fever, especially since there are so many pages of diseases that we could choose from. However, I decided to choose yellow fever because when I was in high school, my English class was reading a book called Fever 1793. This title was very interesting to me. I normally didn't read, but once I read the title and started opening the book, I couldn't close it. The book was very interesting because it ties to yellow fever, especially during the epidemic where the highest fatalities were recorded. Now, at this time, yellow fever is rare and still is currently in U.S. travelers, but it was popular among tropical and subtropical areas of Africa and South Africa. And I thought it was very beneficial because it pertains to microbiology, and why not learn about yellow fever because it was very nostalgic when I read Fever 1793. And so now we'll just head on to our brochure that I made, and we'll start with the disease and pathogen. And so the first thing is that it's an acute hemorrhagic disease, and it's normally transmitted by the vector of mosquitoes. And I thought it was pretty interesting because the term yellow often refers to the jaundice that affects the patients. In relation to pathogen, it's an arbovirus of the flavivirus, and it's found in tropical and subtropical areas of Africa and South Africa. And then I have my in-text citation, and it was from the World Health Organization. And so after the disease and pathogen, we'll actually head into the virulence factors and pathogenesis. And so, like I said, they're transmitted through infected mosquitoes, but it's through the saliva, and the replication normally takes place in the skin and the regional lymph nodes. And so a good idea is when we're palpating the lymph nodes, you can see if there's any pain, tenderness when you're doing an inspection of if the person has the yellow virus fever. And so the entrance is through a receptor-mediated endocytosis, which means that the RNA synthesis often occurs in the cytoplasm, whereas the protein synthesis is in the endoplasmic reticulum. And so then the next step is when the virins are released, it's actually in the cell membrane, and then the lipid bilayer is then taken from the infected cells, whereas the flavivirus protein main function is for binding and fusion and cell entry, which occurs, and this is how yellow fever happens. And so with the diagnosis, it's actually very hard to diagnose yellow fever, which I thought was pretty interesting, especially during the early stages. With the early stages, you can have a lot of symptoms. We'll talk about this after the diagnosis, but you can have symptoms as like flu-like, and it could be easily forgotten about and just like received differently. And it could also be confused with infections, poisonings, and fevers, like flu-like or any other disturbance in our body. And for detection in early phases, I thought it was pretty interesting where the polymerase chain testing in blood and urine can be identified. And then, however, for the later stages, you would have to do antibodies for testing, which would be doing the ELISA. And I do have to say, it was pretty interesting learning about the ELISA and polymerase chain testing because in microbiology, especially in lab, we were doing the ELISA testing, and it was interesting to connect the lecture and lab, especially with our authentic assessment. And so we did the virulence factors and pathogenesis, we did the diagnosis, we did the disease and pathogen, and now we'll move on to the signs and symptoms. And so with the signs and symptoms, once the disease is transmitted, it actually incubates for 3 to 6 days. Some individuals can be asymptomatic, but however, some others can experience headaches, muscle pain, chills, fevers. Once the first initial phase is finished, there's also an acute phase, which this usually lasts an additional 3 to 4 days, which includes muscle aches, joint fever, just regular aches, headaches, shivers, and loss of appetite. However, some individuals may experience a harsher and more experienced toxic symptom, which this would include more serious problems, and this is where it would be best if you go to a hospital and get everything checked out, and so you have the right and proper health promotion and treatment. And with this, some individuals may experience decreased urination, abdominal pain, heart rhythm problems, seizures, delirium, and bleeding from the nose, mouth, sometimes death as well. We read about the 1793 fever where there was an epidemic, and the epidemic was from United States during that era where a lot of people suffered and died just because they didn't have the technology and advancements, but it was still a very troubling fever. And so we'll move on to our second part of my brochure. And so we'll actually talk about epidemiology first. And so currently it estimates around 200,000 cases and 30,000 deaths each year, and 90% occurs in Africa. About 20 to 50% who have the severe disease die, unfortunately. However, with anyone exposed to mosquitoes in the countries where yellow fever is currently an endemic, it's actually a risk for travelers and for anyone that lives there. Some risk factors for the vaccines that are trying to be implemented are protocols for immunity and safety. And then if you look here, here's the picture. It shows the fever prevalence in the United States and Africa, and you can definitely see the difference. This is where U.S. travelers are actually, when you have to be safe when travelers are traveling into countries in an endemic, just to make sure you get all the vaccines or making sure that you're using the safety precautions. And so we finished with epidemiology. We're going to move on to the treatment. And with the treatment, unfortunately, there's no medication or no medicine to treat the infection of yellow fever. However, the best prevention that we can illustrate is to just rest up, drink lots of fluid, and use pain relievers since one of the symptoms are body aches and fevers. However, if severe symptoms actually occur, it's pertinent for individuals to be hospitalized. And also with certain medications such as Advil and Aleve, you have to watch out for those and protect yourself from mosquito bites, especially since that's the mode of transmission is through mosquitoes. So if you have any suspicion of having yellow virus presented, please go to the hospital and just watch out for any of the symptoms. And so with prevention, the most effective way of preventing yellow virus is getting a vaccine. And it's only one shot. It's safe and very affordable, especially if you travel to different countries, and it would be very important to get a vaccine just to make sure that you wouldn't be able to get yellow virus. And with the mosquito bites, it's also important to use insect repellent, wear long sleeve shirts and pants, and control mosquitoes, the indoor, outdoor, and while traveling. You can't really disperse mosquitoes just to prevent less mosquito bites, so the currency of getting yellow fever is less there by wearing longer sleeves or going outside when mosquitoes aren't around, normally in like the winter or the fall. And so we're all finished with the treatment and prevention, and the current research is very interesting as well. Since there's no treatment for the yellow fever, researchers are implementing strategies to find some. And this was in 2019, and so there's a potential antibody treatment that was developed in 7 months. It's called using a rapid response strategy, which is why it was developed quicker and in 7 months. And so there was only a first phase, and it's called the 1B trial, and this was in 2019. And the next phase is phase 2 clinical trials, which is with infected patients. And as of right now, I looked back at the information and research. There hasn't been any information recorded about the phase 2 trial, only the 1B trial. And that's my current research. And then here are my APA references. Thank you so much for listening to my presentation about yellow fever. I hope you guys learned something, enjoyed something, and are educated on yellow fever. Thank you.